So teeth whitening is when we use a chemical agent to be able to get rid of the stains on our teeth. And there's two types of stains. There's extrinsic stains and intrinsic stains. The extrinsic stains are the stains that we get on our teeth because of the things that we do. We eat a lot of soy sauce or wine or coffee, and those things really will stain our teeth from the outside in. There's also intrinsic stains, which are just kind of the stains that we're born with. Some people have a little bit whiter teeth, and some people's teeth are a little browner. And so that's really intrinsic, how our teeth developed. And so teeth whitening does a great job of the extrinsic stains, getting rid of those, and it can do some of the intrinsic stains as well. So at-home teeth whitening options can be a potentially good option. Now, one of the things that I hear most of all is that it's just not quite as effective as the professional whitening options that we have here at the dental office. So sometimes people will say it doesn't uniformly get my teeth white, or it just doesn't work that well. But some people have had some luck with it. So, you know, it can be used, but it's probably just not quite as good. So professional teeth whitening, there's kind of a couple of different ways that it can happen. One is it can be done in office. Things such as lasers can be used to help whiten teeth. We can also have you sit in the chair where we put a very, very concentrated chemical in your tooth that really gets your teeth white very, very quickly. So that's what can happen in the office. The other thing that we can do in the office is that we can make custom trays that go on your teeth. After taking a digital impression of your teeth, we can make these custom fit to your teeth and make them so that there's just the right amount of the chemical right up against the tooth where we want the teeth to get whiter, to be able to do that very, very effectively. So that's kind of the difference, is that the in-office is going to be much more tailor-made to you. It's going to be much more effective, whereas the at-home kits that you can get at Walmart or Target or any supermarket tend to not be as customized to your teeth, and the chemical that's used is typically not quite as strong as the ones that we use here in the dental office. So the best at-home teeth whitening method is the method that we use very often here at Matheson Dentistry. What we'll do is we'll bring it in, and one of our assistants will take a digital scan of your teeth. From that scan, we'll be able to reproduce a 3D model of your teeth. And from that 3D model, we'll actually make trays that are custom fit to your teeth. Now, the trays will have a little extra space right on the front side. So there's a little space in between your tooth and the tray. And the reason for that is so that there's actual space for the whitening gel to actually do its work, to have a nice thick amount of that whitening gel right where it needs to get your teeth whiter. So we'll make these trays. We'll show you how they work. We'll give you some of the tubes of the whitening gel, and then you'll start using them. Typically, you'll do it 30 minutes a day for about 2 weeks, and that usually gets a great result. So sometimes people will ask, can I use my retainers? Not really, because your retainers are they fit intimately up against your teeth, and that's what they're supposed to do. They're supposed to hold your teeth in place. The whitening trays have a built-in little bit of space on the front side so that there's enough room for that whitening gel to do its thing. They're also a little floppy. I don't know if floppies they're not as rigid. That's probably a better word to use. They're not as rigid as, you know, the retainers are. And again, that's for a reason, so that more of that gel can be in around your tooth and to do the work that it needs to be done. So natural at-home teeth whitening options can sometimes work, and they typically will work more on that extrinsic stain that we were talking about. The thing about it is, typically your hydrogen peroxide that you're getting at home isn't nearly as strong as the type of hydrogen peroxide that we use here in the dental office. So while they can work, they're certainly not quite as effective as the professional teeth whitening systems that we offer in the dental office. If you are using an at-home teeth whitening kit, one of the things that you want to look for is that however the kit delivers the chemical onto your teeth, it should be very uniform, so that your teeth don't get kind of splotchy and parts of your teeth are white and parts of your teeth aren't whitened. So you want to make sure that it covers your teeth evenly. You also want to make sure that it's not getting your gums irritated, and you want to make sure probably that the whole reason for doing the over-the-counter ones is that they should be less expensive. Obviously, sometimes it's a little more expensive, but actually, as I have looked at the costs compared to our office, it's not that much different. So if you're going to do it at home, I guess you would want it to be super cheap. But my recommendation would be come on into the office and let us show you what it would look like to do a professional teeth whitening. Oftentimes, it's not that much more expensive, at least in our office, than just getting the over-the-counter things at Target and Walmart, and you'll probably get a much better result. So you can whiten your teeth multiple times, and there are definitely people who, when they come in for their cleaning, they'll also get a few more of the tubes of gel so that they can continue to whiten their teeth. When you make those trays, as long as you're not doing orthodontics or any major crowns or anything like that, you can continue to use that same whitening tray forever. And so every 6 months you can come in and just get a little more whitening gel to touch up your teeth, and that's totally fine. If I would say there's one little knock on teeth whitening, it is that sometimes in some people's teeth it can make them a little more sensitive. So that's why maybe doing it every week or every month, that might be a little excessive because it'd probably make your teeth a little too sensitive. But certainly doing it once every 6 months, once every year shouldn't be a problem. If you do have a little problems with sensitivity, certainly you can use a Sensodyne type of toothpaste that will help reduce sensitivity. There's other things that we can do here in the office to help reduce sensitivity, again, using lasers or other medicaments that will help decrease sensitivity. So that's something that we can definitely tailor-make an appropriate whitening treatment plan for each individual. So if you have any questions about whitening, don't hesitate to give us a call. We'd love to talk to you about it. So it's not really possible to whiten your teeth in just 2 minutes. Even with the strongest chemicals that we use to whiten teeth here in the office, it takes much more than 2 minutes. So if you read advertisements that talk about whitening your teeth in just a couple minutes or by just using this whitening toothpaste, it's really not going to happen like that overnight. That's not really possible. Maybe using a whitening toothpaste over a long period of time can help a little bit, but certainly not as much as doing a professional teeth whitening. So the big advantage of using professional bleaching kits versus just home remedies is really going to be the strength of the action of the gel or the chemical that we're using to whiten your teeth. So, baking soda, hydrogen peroxide that you get at home, that you have at home, those things can help. It's certainly not going to be the right amounts, the right concentration levels that are going to optimally get your teeth white. So while you can use those at home, if you really want to get your teeth whiter, the best option is to come into the dental office where we can help you really get your teeth white. So maintaining white teeth after bleaching your teeth is really going to depend on your one, level of home care, and two, the types of foods that you eat. So certainly we want you brushing appropriately and flossing, and that's going to do a lot to ensure that your teeth don't darken up. But there are some certain foods that will stain your teeth quicker. Certainly wines will do that. Any kind of berries, those, blackberries, raspberries, those kinds of things definitely stain our teeth. Soy sauce, ketchup, mustard, coffee, things that really stain your white shirt, they're also going to stain your teeth probably. So those are the types of things that tend to darken our teeth. So certainly avoiding those at least for the first week or two if you can, but certainly minimizing those things will help keep your teeth whiter. There are definitely some important steps that you want to follow when doing the at-home whitening kits. One, it's good to brush and floss your teeth before you whiten. You'll want to put a pretty small amount, maybe like somewhere between a grain of rice to a pea-sized amount in each little tooth well, kind of on the front side, on the side that faces your lips or cheeks. I don't really recommend whitening all the way back to your molars. If you smile really big, so a lot of people don't even show their molars, so it's just kind of a waste by whitening those back there, and your bleach will go farther if you don't. I usually recommend that you concentrate on the front 8 teeth, maybe the front 10 teeth if you kind of have like a Julia Roberts smile, but mostly it's usually just the front 8 teeth. You don't necessarily have to put the gel on the back side, on the tongue side, because again, that's not really what you're trying to whiten. You're trying to whiten the side that is visible, and certainly on the top and on the bottom. So one really important thing to know when it comes to whitening is that anything artificial isn't going to whiten. So crowns, veneers, fillings, dentures, these things really aren't going to whiten by using whitening products. So if you are thinking about whitening and you have a little bit of dental work to do, you actually want to whiten your teeth first if any of that dental work is going to be showing. So if you have some fillings in the front, or a crown or a bridge or an implant or something like that that you're going to do that's going to be permanent and there for a long time, you got to kind of think of it as it's not really going to change in color, but your teeth can. So the ideal would be you want to whiten your teeth first, get them to how white you want them to be, and then go ahead and do your dental restorations that you need to have done so that we can match the shade of the restoration, the filling, the crown, the veneer, anything like that, to the rest of your teeth. Really the only big risks of the at-home whitening solutions is, one, it can cause a little bit of sensitivity. Every dental whitening system is a little bit different, and so some of them may cause a little more sensitivity than others. But sensitivity is really the main thing that people talk about when whitening your teeth. It doesn't damage the enamel. It can be a little irritating to the gums. So that's why having a custom-made tray for your teeth can really help prevent that burning of your gums. Because that would be the only other potential complication, is just kind of, some sore or ulcerated or damaged gums because the bleaching agent just kind of got all over the place. So there have been studies done that show that really bleaching does not damage the structure of enamel. It can help to eliminate the extrinsic stains and even the intrinsic stains in teeth, but it doesn't do any damage to the enamel. All right, well, thank you so much for listening to this today. If you have any further questions, or if you're interested in whitening your teeth, please give us a call here at Matheson Dentistry at 480-888-8123, and we'd love to talk to you about it.